I'm going to share with us the types of vaginal discharges, if it is normal or abnormal. First of all, what is vaginal discharge? Vaginal discharge is most often normal and regular occurrence. However, there are certain types of discharges that can indicate infection. Abnormal discharge may be yellow or green, chunky, inconsistency, or foul smelling. Okay, what usually causes this infection? It's yeast or bacterial infection. The vaginal discharge serves as an important housekeeping function in the female reproductive system. It helps to flush out dead cells and bacteria from the vagina and cervix. It helps to keep the vagina clean and free from infection. However, we're going to look at the different types of vaginal discharge so that you'll be able to know the normal and then the abnormal. Okay, number one, we have the clear and the watery discharge. This is normal. Okay, it can occur at any time of the month. If you notice that this clear discharge is heavy, it is because maybe you did a heavy exercise or a heavy thing, you know what I mean? But believe me, it's normal as long as it's not smelling. It's cleansing your vagina, it's cleansing your cervix. That is why you need to be changing your pants, your underwears, or you wear breathable panties. Number two, guys, we have the white vaginal discharge. A bit of white discharge, especially at the beginning or at the end of your menstruation, is perfectly normal. However, if this discharge is accompanied by itching and is like a cheese and is thick and is like consistency or appearance, then it is not normal. This could be a sign of yeast infection and you need to see a doctor or you need to treat it. Number three, clear and stretchy. So when you notice that your vaginal discharge at this moment is clear but it's stretchy, it indicates that you are ovulating. This period you can get pregnant. You notice when it's stretchy, like it's when you do like this, it's like this, like kind of slimmery, like kata, right? It's normal. Okay, it means you are ovulating. There's nothing wrong with you. Okay, so you just have to be careful. If you don't want to get pregnant, you have to be careful at this moment. But if you want to be pregnant, then go ahead. Okay. Number four, guys, if you notice that your discharge is yellowish or greenish in color, it means you have sexually transmitted infection. Okay. When this discharge is thick, chunky, or accompanied by an unpleasant smell, believe me, it's not normal. Okay, it could be a sign of trichomoniasis infection, commonly spread through sexual intercourse. So you have to know your partner. Okay, number five, guys, we have the red, the brown, or the bloody kind of discharge. Guys, this kind of discharge is usually normal, especially when it occurs during or after your menstrual cycle. A late discharge at the end of your menstruation can look brownish instead of red. You can also experience some small amounts of blood during your menstrual cycle. This is called spotting. Okay? In rare cases, bloody or brown color or discharges could be a sign of endometrial or cervical cancer. It could be other problems such as fibroids, other abnormal growths. It could be menstruation or cervical polyp. So this is why it is important to get a yearly pelvic exam or pap smear. Guys, I don't do that. I've never done that. But now I'm going to start doing that. Honestly. Okay? Because when you visit your doctor will be able to check for cervical abnormalities during these procedures. Okay, number six, we have the pink discharge. It could be shedding of the uterine lining after delivery of baby, so it's normal, known as lochia. And also it could be cervical bleeding, vaginal irritation, or implantation bleeding. Number 7, great vaginal discharge. It simply means that you have bacteria vaginosis. Okay, guys, I want you to know that it is normal for your discharge, your normal discharge, okay, to increase when you feel horny and ovulation. Exercise, birth control pills, emotional stress, all these things may also result in discharge. Okay, so the abnormal vaginal discharge is what is usually caused by infections such as yeast infection, bacteria vaginosis, trichomoniasis, gonorrhea and chlamydia, pelvic inflammatory disease, human papilloma virus, or HPV. So when you have these abnormal discharges, try and seek medical help. So how can we care for these vaginal discharges at home? To prevent infection, practice good hygiene and wear breathable underwear, cotton underwears, okay? Don't use douches. You know douches? All those things you pour inside your vagina. It can make your pH imbalance. It can reset it. For those of you that don't know what is douches is a process whereby you are washing or cleaning inside your vagina, or you are soaking it, either with water or other mixture of fluid. Some use baking soda, some use vinegar, and some use iodine. Do not do it because it can change your pH balance. So that is douching, okay? Do not do it. Practice safe sex. Use condom, okay? Do not sleep with different partners. Drink lots of water. Guys, I have already shared with you how to get rid of bad odor and stuff like that in my other videos, okay? Wear breathable underwears, walk around naked for air to go inside your vagina, okay? If you are doing this, you can prevent all these infections that I have mentioned. If you have any question, you can leave it in the comment section. I will reply you, okay?